Hello everyone, it's Nicole here at Warrington Dermatology, CoolSculpting Pro. I am here with the lovely Donna, here to perform a live treatment today and show you just how easy it is to come in and have CoolSculpting done on any body area that may be a good fit for you. Behind the camera we have Carrie, she is going to be helping out, commenting here and there, and also letting me know if you have any questions today.
Hi everyone, don't be shy, go ahead and like and comment.
So, just for the sake of doing the demonstration today, we already have Donna here hooked up to do her arm, one of her arms, so that way we are able to show you what it looks like in the process of when we are done and removing the applicator. Typically, because of the treatment that she is doing, she's only doing 2 applicators, 1 per arm, so we are usually able to do that in a 35-minute sitting. So you are in and out of the door if you're just doing the arms here, in and out in under an hour. So for the beginning of the process, when you come in and you have the consultation, I go over everything with you about how CoolSculpting works, what it does, and why it might be a good option for you. So CoolSculpting is the targeted freezing of fat cells to a particular body area. We can treat the under the arms here, we can do the submental, the abdomen, inner thigh, outer thigh, above the knee, flanks, pretty much everywhere from here to about the knee area we can treat, as long as that's pinchable fat. So the applicator, which looks just like this, this pulls the tissue in all the way down here to the bottom of the cup, and that gives you that targeted freezing of those fat cells. And depending on the size of the applicator that we're using, your treatment can range anywhere from 35 up to 75 minutes. And I'd say probably within the first 5 minutes is when all of those tissues, it goes cold, numb, and you really don't feel anything for the remainder of the treatment.
How you feeling, Donna?
I feel great. It feels a little bit cold on the back of my arm, but I'm not uncomfortable. In fact, I just feel like I'm at a spa.
Yeah, and just so everybody's aware, girlfriend's been watching some Netflix, so it's a very relaxed situation. Thanks, yes. Nicole. Go right ahead.
Yes, and so this arm here that we're going to get ready to show you just here in a few minutes, I've already got her hooked up, not hooked up, I'm sorry. Already got it drawn out where we're going to place the applicator.
And how did you decide what that was going to look like, Nicole?
So we have a couple different applicator templates here. We have this one here that's used for the arms, and then we also have this one here as well. So you can see both of these are 2 different sizes. So basically I take this and I assess the arm here to see what might be a better fit for her. For Donna here, this one is definitely the better fit.
Oh yeah, you can see how the fat just goes right in there.
Goes all the way down to the bottom there, and that's what
Perfect.
we want. So that way we know that you're getting a full, complete treatment.
And so that's simulating what this is going to get pulled into that cup. And so
Yes.
that's the tissue that's actually getting treated. I see.
Yes. So with that being said, there's a famous saying that it takes 2, because 9 times out of 10 it is going to take you at least 2 sessions to come in to be happy with what you've spent here with CoolSculpting. You come in for your first session, and then about 6 to 8 weeks later I have you come in for your second session, and then we do pictures at each stop. So pictures day of your treatment, pictures when you come in for your second treatment. That way we're able to see your before and afters already by the time you come in for your second treatment, because you can definitely see your results by the time you come in for that second treatment. Your full results from treatment are going to be 3 to 4 months post each treatment. So after you complete your second treatment, I have you come in 3 to 4 months later, so that way we can see your full results from both treatments.
And so when we have our consultation appointment, Nicole, that's when you kind of know how many treatment cycles we're going to need during each treatment session, and then that's going to determine pricing?
Yes, absolutely.
And can we just remind everybody that as our thanks for participating in today's event, we're offering 20% off any treatment packages that are purchased by people who attended today's session, so we're excited for that. Okay, well, it looks like we've got about 30 seconds left on her existing cycle that she's just about to complete on this right arm. So Nicole, you want to walk us through what this is going to look like?
Yep. So once this counts down, I'm going to go ahead and turn the suction off, and then I'm going to get everything removed, just that way I can remove the applicator and the gel pad, and then we're going to do a post 2-minute massage to the area to help get all of those frozen fat cells broken up, because we want to get them exiting through the body system.
Right, and I'll remind everybody that we are going to be hooking up her left arm when we're done with the post-treatment process here, so you'll get to see what that looks like as well.
So we're just going to remove everything. So the biggest thing with CoolSculpting is we have to support the applicator as much as possible, because we don't want to cause any pop-offs to happen, which basically means the applicator has become detached from the fat pad that we're treating. So there is lots of padding around the applicator to support it during treatment. So we're just going to pop this off here. Remove that applicator.
So we can see this is the gel pad that protects her skin from the very controlled, precise cooling that freezes the fat cells but does not damage the exterior tissue. So, Donna, are you feeling anything in particular now?
No, nothing.
No, nothing at all. Okay.
Just feels cold.
Just a little cold. And you can see there is some redness from the cold. Just like if you were outside playing in the snow, your hands might get cold. They might get a little bit red. And I personally have had CoolSculpting as well, and I will tell you that as the tissue comes back to temperature, to me it felt very much like when you've been out in the cold and you come in, and as you're warming up, you kind of feel like a prickly tingling, right?
Yes,
and
that is the best way to describe it.
Like
for
your
sure.
leg is falling asleep or something.
Right. I wouldn't say painful, but I would say, it can feel slightly uncomfortable, and plus you've got Nicole kind of like rubbing on the area, but you can see Donna's not really in any discomfort. She's just kind of going to feel what's going on. And the massage process, it turns out clinically, is very important, because we want to break up those fat cells that have been frozen. We want to basically kind of crush them and open them so that fat is going to leak out into Donna's system, and then it's going to be reabsorbed as a part of her body's natural waste management process, and she's just going to eliminate it along with her other body waste. So, easiest thing she'll do all day.
Yes. So we've got about 45 seconds left of the massage. A good thing to remember right now, because a lot of patients are starting to do the weight loss injections. Biggest thing with that is it is helping you to lose the weight that you would like to lose. However, it is not targeting specific pockets of fat that might not go anywhere. So if you're still being left unproportioned after doing the weight loss treatments, and you still have some sculpting to do because it's not exactly what you want it to look like, that's where CoolSculpting is a great fit. And Donna here can speak to that as well.
Yeah, it's a compliment, right? Because Donna, you had a lot of success with weight loss injections, right?
I did. I lost 37 pounds.
It's wonderful.
But I still have baggy arms.
Yeah, more fat than you want in that
Exactly.
particular area. I think that's true for most of us, is that we are not necessarily proportioned. Some of us have more weight in our lower body than our upper body, so we lose the weight from everywhere, but we still feel heavier below than we want to. So CoolSculpting is a great way to shave an inch or two off your thigh if your pants are a little tight in the thigh area, or maybe if you still have that little muffin top, even though you've lost the weight. The sculpting, that's what we're trying to do, because CoolSculpting is not a weight loss.
It's not. I've been on the medication for about 10 months now. Lost the 37 pounds that I wanted to lose. I have a few more that I want to lose, but I knew that this was not going to be lost.
Yeah.
And so I came over, got assessed with Nicole, and she recommended that I get that. She said my fat was perfect fat for CoolSculpting, and so I'm going to have the recommended 2 treatments.
Yeah, and that's a good point too, is that there are different kinds of fat, and hard visceral fat is not going to respond well, correct, Nicole? We want the squishy, pinchable fat.
Yes.
Yeah.
All the squishy fat.
Okay, so it looks like we're ready to maybe get started. Now we're done with the massage, and Donna's first treatment is absolutely in the books. And so now it's just a matter of letting her body do her thing.
Yeah.
So Nicole's going to show us now what it looks like when we're getting started
Yes.
with a treatment cycle.
So first, of course, since I've already marked the area, the next step here is just to wipe down the area with this pre-treatment wipe, which just helps cleanse the skin from any oils or anything that might for any reason cause any issues with the cold transferring through. So we have to do this for just 1 minute before we put the gel pad on. Donna, how's your other arm feeling right now?
It feels fine. Still feels a little cold, but that's all. No pain. I'm not uncomfortable.
That's so great. That's what I love about CoolSculpting is you come in, you get your treatment. As you can see, it's perfectly comfortable during the treatment. She's got her phone laying next to her. She could be scrolling, watching a little TV. It's actually a really relaxing time. And then when you leave here, you actually just step right back into your day. There is literally no downtime to this procedure. If you don't mention it to anyone that you had something done, they would never know.
Yep, if anything, depending on how many applicators you do in a single sitting and also the area that you're treating, it's just going to feel like you had an extreme workout at the gym.
Yeah, a little, almost like muscle soreness in a way.
Yeah.
Maybe a little mild swelling just from the inflammation that comes along with the destruction of the cells, but probably nothing that, would get in the way of, you wear absolutely your same normal clothing, just go about your normal day.
So the next thing that we're going to do to get this arm ready for treatment is apply the gel pad. The gel pad, we call it a second layer of skin. You can see it's very gooey, so I do my best to protect the clothing that you might be wearing. Like I have this paper towel here because it does like to travel. But we call this second layer of skin because it protects your skin from the cold. So that way you're not getting any frostbite or burns to the skin.
And really, even if it got on your clothing, it's just annoying.
Yes.
It washes right out.
Yes.
Yeah.
So we're going to apply this. We're going to cover the entire treatment area that I already marked. We do have to use Sharpie to mark the treatment area the day of treatment, so that way when we do all of the pre-treatment wiping, we can still see where we have marked for treatment.
Right. And I just want to remind everybody, go ahead and like or comment, shoot us a question if you have a question. We're happy to address it if there's anything that we haven't explained well for you or that you're curious about. Also, we're offering 20% off to anyone who books a consultation and decides to purchase a treatment package after having watched our event here. We're happy to be able to offer that to you.
All right, so we're going to go ahead and get this applicator on. I'm going to line it up here where I already have marked, and I'm going to lower Donna's arm down here into the cup. You can see it grabbed on, which is exactly, of course, what we want it to do. You can see on the screen there it says that it's ready, which means that it has full contact with the tissue just how we want it to, so that way we are able to start the treatment.
And then you're just strapping those blue straps on to hold it in place?
Yes.
Gotcha.
So we want these straps to be kind of on the snug side, especially for the arms, just because, like I mentioned before, we don't want the applicator to pop off. Okay. Feedback from the patient is always good during a treatment, so that way we make sure it goes as smoothly as possible.
Yeah, and really the main job of the patient is just to be as still as possible, not to move around much, just so that the placement of the tissue in the treatment applicator is not disrupted. But she gets into a perfectly comfortable position there.
So these towels I'm just placing here to give that applicator extra support because we don't want it to move. And that's really your only job during treatment is just minimal to no movement in the area that we're treating. So that way we can ensure a smooth treatment.
Right. And
How do you feel, Donna? Are you comfortable?
I'm fine.
Perfect.
Yeah.
So we are ready to go
get
ahead
going?
and hit the start button. So this one is 35 minutes, as you can see here, and you can see where we're targeting. So we're going to go ahead and hit start. and it'll start the countdown, and Donna gets to sit here and relax and watch Netflix for the remainder of her treatment.
Excellent. Now, Nicole, what is this button that's here?
Yeah, this button right here is her call button. So when she pushes this button, Donna, go ahead and push it for me. It'll send a little alert. I have to push it a little bit harder. This little notification here, and it comes up and it alerts me on my phone. You'll see the message just came through. So that allows me to come in and check on her. I can reposition anything if needed.
Right.
Help with the TV, get her some water, whatever she needs to make herself comfortable for the rest of treatment. That button is a great tool for the patient while they're here.
Fantastic. All right. Well, we're close to wrapping things up. Does anybody have any questions? Just shoot us a comment or a question. We're happy to answer.
Please remember, you can go ahead and schedule your consultations at any point in time. Go ahead and like or comment in the video so that way we know that you attended the live. When you call in to schedule the consultation, just say you would like to book as a part of the live demonstration, and you get to earn 20% off of any treatment package that we determine is best for you when you come in for your consultation.
Right. So just a reminder that basically we can treat anywhere from chin to shin. So, under your jawline, your thighs, your abdomen, your back fat, your bra fat, your underarm, all of the areas. If there's an area that concerns you that you're wanting to shape, CoolSculpting can more than likely help.
Yes.
Yeah.
I would love to see you. So go ahead and give us a call. Send in a message, comment below, so that way you can get that 20% off. And if you have any questions, of course, let us know. We'll be glad to answer them even after the live is over. Donna, you're still feeling good?
I feel great. This is so worth it.
And we'll be following Donna's treatment story as we go on. We'll show you her before and afters from this session. We'll show you, if true to form, she needs that second session like Nicole described. We'll just keep you up to date with her treatment progress. So stay in touch, like us at Warrenton Dermatology, and follow us so that you can kind of stay up to date on everything. And thanks so much for joining us today.
Thank you for joining us. We hope this was informational for you.
Okay.
Bye.